Good afternoon, everyone. I am Dr. Hrishikesh. I am a final year medicine resident here in India. And today I would be presenting this rare case of reverse Lemierre syndrome. So firstly, I would like to just explain what is Lemierre syndrome. So in Lemierre syndrome, there is a characteristic triad of three things. That is the severe oropharyngeal infection. Associated with that, there is a interjugular vein septic thrombophlebitis, and then that complicates as a septic pulmonary embolism. Now, what is reverse Lemierre syndrome? I would be explaining it through my case. So, he is a 18-year-old boy who presented to us with a history of a trivial fall followed by some muscular strain. And he came to our emergency room with the history of fever for 2 days with slight swelling and pain in his right leg. So, when we examined him, as you can see here, this is his left leg, this is his right leg, and the right leg was showing some swelling and it was warm and it was tender. When we examined him, his respiratory rate was also increased. He was febrile, and on auscultation, he had bilateral basal crepitations. So we first went ahead and got his X-ray done, and this was his X-ray. So the X-ray was showing bilateral white opacities, which looked a bit like consolidation. So our initial clinical diagnosis was right thigh abscess with pneumonia with hypoxemic respiratory failure. So his labs, when the labs came, his total leukocyte count was also elevated. It was almost 34,000. And so we went ahead to evaluate his leg swelling, and we got an ultrasound Doppler done, and it was suggestive of deep venous thrombosis, and it was involving the saphenofemoral vein and the popliteal vein. It also showed the presence of a pus collection in the leg muscle, predominantly the vastus lateralis muscle, which was suggestive of pyomyositis. Now, in this setting, as the patient was having clinically DVT and he was in hypoxemic respiratory failure, we further went ahead to perform a CT pulmonary angiogram just to rule out embolism. And it did show us embolism, but it was not as if a thrombus which was just dislodged in the pulmonary circulation, but something like this. So you can see here the bilateral basal consolidations with the internal breakdowns and septations here. Even on this CT cut, you can see this. So this was suggestive more of a septic pulmonary emboli rather than just a thrombus which had dislodged. So now we had these three manifestations in a single patient, that is pyomyositis with septic pulmonary emboli, and there was this DVT. Now, we wanted to correlate these three things into just a one single disease, because rather than having three different diseases in the patient. And we did some literature review and we did know something about Lemierre syndrome, but we further digged in into the various literature and we found this reverse Lemierre syndrome. So this is something which is similar to Lemierre syndrome. The only difference is the source of infection, rather than being in the oropharyngeal area, it is in the lower body, that is in the legs or sometimes in the pelvic region. So this patient, he had pyomyositis, and this infection and inflammation incites the Virchow's triad in his leg vessels. The veins that were involved in him were the saphenofemoral vein and popliteal vein. And that was actually not DVT, but it was septic thrombophlebitis. And this septic thrombophlebitis was basically spitting out the small septic emboli to his pulmonary circulation, and that landed up as a septic pulmonary emboli. So this constituted the triad of this reverse Lemierre syndrome. So in his management, further we did an ultrasound guided pus aspiration from his thigh, and we sent it for culture, and it grew Staphylococcus aureus, which was sensitive to vancomycin and clindamycin. So we upscaled the antibiotics accordingly, but unfortunately, after a few days, the swelling kept on increasing. So we had to drain it surgically. And we almost drained 200 milliliters of the pus in quantity. And fortunately, after draining the abscess and when we upscaled the antibiotics to Vanco and clindamycin, yeah, the patient started to improve clinically. His fever started to go down. He became afebrile after almost 2 days of the antibiotics, and almost after 1 week of antibiotics, oxygen therapy, bronchodilators, anticoagulation, the patient became clinically very well, and we discharged him after 1 week of hospitalization. The point here is this would be the fourth case report worldwide. The first case of this reverse Lemierre syndrome was seen in France, and it was found in a soccer player. And two another cases were from India, from All India Institute of Medical Sciences, and out of which one case was a elderly diabetic male, and another one was a young boy, and very similar to our case. He was a 17-year-old boy. So this case signifies the importance of diagnosing this clinical entity a bit early, because I feel that this case is underdiagnosed and underreported as well. So just diagnosing this case in a prompt manner and giving a prompt intervention would definitely have excellent prognosis in these set of patients. So thank you for letting me present this case on such an international level, and I'm open for any questions if there are. Thank you.